So I will just repeat the case. Daniel is 7 years old, known to have spastic quadriplegic cerebral palsy. He was born at 27 weeks gestation by emergency cesarean section, admitted 2 months afterwards. Mother complains that he has vomiting and refusal of feeding orally. His GP reported poor weight gain, weight at 0.4th centile, height at 10th centile. He has NG tube in situ. Take focus history from his mother, Christina. Okay. So Dr. Krishna, you can keep the time, and Dr. Deepa will start.
Spastic quadriplegia, right?
Yeah.
Hmm.
So Dr.
shall
Deepa,
I'm starting now.
Daniel 7 year. Okay.
Okay. Start, Dr. Deepa.
Hi, good evening.
Good evening.
Yeah, hello, I'm Dr. Deepa, one of the children's doctor in this hospital. So I believe I'm talking to Daniel's mother.
Yes, doctor, it's me.
How may I address you?
Pardon?
How can I call you?
My name is Christina. You can call as Christina, no problem.
Hi, Christina. Nice to meet you today. How are you doing?
Thank you so much, doctor. I am fine.
So I was informed via the GP letter that you have some concerns regarding your child Daniel's health recently. And I was being informed that Daniel has been suffering from cerebral palsy. So can you please elaborate on your recent concerns on his health?
Yes, doctor. My son is suffering from. He is not taking enough milk. We feed him both oral and by the NG tube, but he is not taking it sufficiently. And recently, there is reduce in his weight. This is my concern now.
Okay, so since exactly how long you have been noticing this refusal of feeds and not taking?
2 months.
Okay, before that he was okay with his feeding?
Yes, he was fine. We are using both oral and NG because oral is not sufficient. He don't suck much. But before 2 months, it was okay. He was on his second centile for weight. But now, over a period of 2 months, during his last checkup with the GP, his weight has come to 0.4th centile. This is what he told me.
Okay, I understand you have been very worried regarding this. So has he been vomiting also after the feeding?
Yes, yeah, he vomits.
Okay, so every feed he vomits or only occasionally during the feeds he vomits?
Nowadays, every feed he is vomiting. After I give especially orally, he refuses feeding at all. But even by force, if we give, maybe in 3 minutes or 4 minutes, he will vomit.
Okay, so may I know in what position you usually feed him?
No, doctor have taught us to feed him by keeping him little raised, because from long time he had before feeding problems. That's why we went for NG insertion for him. So we know how to feed. I'm just lifting him and feeding.
Oh, that's nice. So does he have any swallowing difficulty from the very beginning?
No, I mean he has, but as I told you, it's 50-50 or 75 by, if I give 100 ml, I will give 70 ml by NG tube, 30 ml by feeding.
Okay, so can you just tell me if half or more than half of the feed comes out every time?
Nowadays, whatever orally I give, if I give 30 ml to him, he will vomit completely. And so I am just depending on the NG tube, but recently from 1 week, even the NG he is vomiting.
Okay. So is he doing some body movements like arching and all while he is vomiting or immediately after the feeding?
Yes, doctor. He has, after he vomits or before that, or sometimes after that, there is arching of his back, and also he does some strange movements. I think that it's convulsion.
Okay, so he's not conscious at that time of the movement?
No, he is conscious.
Okay. So how long does this movement last?
He gets, actually I feel that he gets relieved after vomiting. This is my feeling. And after this moment, it maybe 3 minutes.
Okay, okay, okay. So have you taken any video recording of the events?
Yes, doctor, I took the video recording because when I approached the GP, telling that my child has convulsion, he asked me several questions and told that this may not be from convulsion.
Okay, okay. So
And he asked me the video recording.
okay, so I understand you are a very keen mother, Christina. So is he having always the drooling of saliva, that is the saliva coming out from the corner of his mouth?
No, I don't see that.
Okay. So may I know when was his NG tube inserted? How many months back?
Actually, from his very small age, maybe when he was maybe I think 4 months old.
Okay. So how is his activity otherwise? Is he same as previous, or he is very irritable or dull when compared to this?
Before he was good, before 2 months, but nowadays because he is not taking sufficient feed and there is reduction in his weight, I feel that he is irritable and most of the time crying like this.
Okay. And has his this complaint affected his sleep also?
Yes, doctor. Sometimes if he don't feed well, he will be moving and he will cry in the sleep.
Okay, okay. So is his potty and pee normal, or is having any issues with that also?
No, his poo is okay. Before he had constipation, but now he is on Movicol.
Okay.
I give him every day 1 sachet and he's passing every day.
Okay. So he's always on diaper?
Yes, he is on diet.
Okay.
1 minute, I will mute all. Please open your mic again. Okay, go ahead. Dr. Deepa, open your mic.
Yeah, so since,
Okay.
Christina, since Daniel is having this complaint since his birth, I would like to know more about his time during the birth, okay? So during your pregnancy, were all scans done?
Yes, scans was done and he was growing well in the tummy, no problem.
Okay, can you just, were you admitted because of any infection or something in the hospital during your pregnancy?
No, doctor, actually no infection, but there was some bleeding in I think in 7th month. And this was the reason that the doctors made him born early by cesarean section.
Okay, so around 7th month he was born because of bleeding. Were any cause told because for this bleeding? Did doctor inform anything why this bleeding has happened?
No, I don't know any particular cause, but they told that this is an emergency. We have to deliver the baby urgently to save both mother and the baby.
Okay.
And so he was just 27 weeks old at the time in the tummy. And he was on the machine. He was breathing on machine for maybe 10 days. And then he was shifted to tube breathing for some 2 weeks. Then he was okay.
Okay. So do you remember his weight at that time of birth?
Yes, doctor, it was 1.2 kgs.
Okay. So can you just elaborate me on the feeding? How was the course of the feeding when he was in the newborn period and in the ICU?
Actually, he was taking very less feeds when he was born, and his weight was also low, and he was taken care in the neonatal care unit for this weight gain. I don't know much because they did not discharge him until he gained a weight of 2.5 kgs.
Okay, so after that he has been okay with his weight, right? Apart
Yeah,
from
yeah,
the
he was okay. I told you at 4 months NG was introduced. Till 4 months he was okay and gaining weight, but suddenly there were some problems in during that time. Then we added NG and oral. He was fine, but progressively his NG was increasing and oral was decreasing.
Okay. Did he have any other issues like any bleeding in the brain or infection as doctors informed you when he was in ICU?
No, mainly breathing was the problem.
Okay. Okay, Christina, can you just tell me which all doctors you have met so far for Daniel's care?
Yes, he's following up with many doctors, even the gastric team. He's following
10
up,
minutes.
Okay.
and 10 minutes. Okay, 4 minutes left. He's following up with the gastric team, and they told him to solve this. He's on some medications as well for that. They have given him some medications to reduce this problem.
Okay. So he was been improving with that.
Yes, but nowadays from 2 months, despite of giving regular medications, he is deteriorating.
Okay, so he's on any exercises like chest physiotherapy, muscle exercises or anything?
Yes, he has been taught by the GP and also by the specialist doctors in the hospital. But I am very busy nowadays. I am not able to do everything for him.
Okay, so other than that, any blood test or brain scan, anything has been done for him?
Recently, no.
Okay, okay. So you're being in constant follow-up with up with the doctors. That's what I understand, Christina.
Yes, yes.
Okay, so is Daniel's father and you are staying together?
Yes, we are together.
Okay, do both of you work?
No, I am not working, but his father works.
Okay, so you are able to take care of Daniel all the time, right?
Yes, but now I also have a 6-month-old baby with me. And I am busy with that baby feeding. So there is a problem of taking care of Daniel now.
Oh, I understand that. So you'll be having a very busy schedule. So that is
Yes.
affecting his exercises also, right?
Yes, I cannot give the care what I was giving before 6 months.
Okay, so are you linked to any social support groups?
No, doctor. Previously we were linked, but now we changed our house. So now recently from 1 year, I am not linked with them.
Okay, so has jabs been done completely for Daniel?
Yes, till now up to date with some extra jabs also for the chest. They say, I don't know the names, but for the chest infection and flu.
Okay, so is Daniel able to sit by his own or he is fully bedridden?
No, he's or able to roll over only.
Okay, how does he communicate with you? Does he tell some words or only actions?
No clear words, actions, and he has emotions like smiling, crying. When he's happy, he gives a smile. Otherwise, he cries.
Okay, is there any concerns with his hearing and vision? All this test has been done.
Hearing is done fine, but vision, he has some squint.
Okay, so have you been following up for that also?
Yes, with eye doctor.
Okay, so otherwise you are able to continue his medications apart from the exercise regarding the Movicol and vomiting medications?
Yeah, medications I am giving. Like he has epilepsy also, for which he is on sodium valproate. And
Yeah,
Time over. Finished.
I'm finished. Okay.
It was nice talking to you, Christina.
Okay, thank you. 1 minute. So present your case.
I have taken history from Christina, mother of 7-year-old Daniel, who was born prematurely at 27 weeks of gestation due to bleeding. And he had a stormy neonatal course of 2 months and was diagnosed as spastic quadriplegic cerebral palsy. And the mother presents with recent concerns of regurgitation and vomiting after feeding orally and with ingitube, which is gradually worsening over 2 months, and he has poor weight gain noticed over these months, and associated arching of the body is also present. His other comorbid conditions are constipation, which is getting controlled with Movicol, and seizures, which he is on sodium valproate. And other social mother has some issues regarding his exercises and medication, as she is busy with the younger sibling.
Okay. So how do you want to proceed with this case?
Since there is a poor weight gain, arching of the back, I would consider it, Daniel would have a severe gastroesophageal reflux disease. And
Before that, sorry, give me your differential diagnosis.
yeah, so my differential diagnosis would be severe gastroesophageal reflux. Mm,
Okay.
yeah. Other
Then
would be
give me one more, at least 3. Okay. First one is the severe gastroesophageal reflux disease. Next.
otherwise, it could be due to the ongoing severe pseudobulbar palsy, which a child could have associated with the spastic quadriplegic cerebral palsy.
Okay.
Then, yeah, I could not remember.
Okay, no problem. 2. Discussion we will do later. Okay. Evaluation. How do you want to proceed with this child?
So basically, you have to do a thorough physical examination and go on with the basic blood test and neuroimaging to know the cause of the cerebral palsy. And for the recent onset of this vomiting, we need to do any metabolic screening, whether there is any other metabolic conditions are associated, and also the serum electrolytes will have to be done.
Okay, apart from the metabolic screening and serum electrolytes, what else you want to do, the investigations?
We can go for the genetic studies as well to know the cause.
All these things may, because now he is 7 years old. For the CP, they would have done everything. But now for the present condition, tell me what you want to do.
I think I can remember only metabolic screening.
Okay, for the present condition, you are telling only metabolic screening and electrolytes, right?
Okay.
Okay, this is
And
the blood. What else?
otherwise, I can go ahead with the test for gastroesophageal reflux after discussing with my
What test
consultant.
you want to do?
Fluoroscopy and endoscopic studies.
First one, what you said?
Fluoroscopy.
What do you mean by fluoroscopy?
To see the movement of the food into his body and whether how much reflux is happening. Otherwise, we can go for the plain X-ray like barium needle.
Okay. So you said upper GI endoscopy and fluoroscopy. Okay. Anything else you want to tell for the management of this patient now?
We can go for a swallowing assessment.
What assessment?
Swallowing assessment.
I did not get. What do you mean by that?
To check with the how his swallows, the swallowing assessment we can.
Swallowing assessment. Okay.
Yeah.
Okay. Apart from that?
Yeah, that's all.
Okay. So now he has, your diagnosis is severe GERD. How you want to, how you can solve this problem with medications?
So
Medically and non-medically, both you have to tell.
medically, we have to give the anti-reflux medications for quite a long time.
Okay.
And also, anti-reflux medication can be given.
Okay. Okay. This is the treatment for medical. Anything else? He is
And
already on anti-reflux medication. I told you, you asked me, I told you he's on omeprazole and some anti-acid medication. So what you want to do? He's already on that. Anything you want to do for that?
so we can gradually increase the dose. And the thing is that we can change to a semi-solid diet. Diet can be changed to semi-solid.
Okay, this is already in severe. Maybe you may not increase with the diet. Okay, anyways, we will discuss about it later. So you will review the medications and its dose.
Yes,
Okay,
and we will also
maybe
check
the
the
dose is
compliance.
not sufficient for him. And also there is a component of neglect here. Mother is busy with the other child and father has the duty and they have no helper at home. This is one more problem. They were connected to social support. Now they are not in the social support. Lots of social things has to be involved here. So you will tell that you will review the medications, and for that you will have a new and urgent referral with the gastroenterologist. Okay.
Yes.
Next is the any surgical you want to think for this patient which can help him?
Yes, as the child is already on NG tubes and still having the symptoms, we can try for the gastrostomy or fundoplication for this feeding.
Okay. So apart from that, tell me the non-medical management for this child you want to do.
The non-medical management would be the positioning during the feeds. As the mother is already been doing that, but we have to just make sure that the position is correct. Then switching on to the semi-solid feed if possible, or small quantity frequent feeds also can be done.
Okay, and apart from that, there are the social issues. So you have to, and mother, if you would have asked, in the social history, what is the impact of this disease on you? Mother would have told that I am depressed now and I am very much tired because I cannot handle my small child and Daniel together. So she is having some issues, so needs to address her psychological concerns and needs to give some social care. Okay, by how you will now, she is not presently because of the change of the house. There is some problem in the social support, so you have to ask her to get connected with the social support groups. And there is respite care. You know about the respite care? Anyone?
Yes, I know about the respite care. Can I add this, Dr. Kolam?
Okay, just wait. Let us see. Deepa don't know. You will add.
The parents
Respite
can take a break while looking after the child. They will be taking care of the child for some time.
Yeah. All these things you have to bring here now. See, when the management comes, just don't think of GERD only. These childs will have multiple problems apart from that. But you will explain about the GERD. Apart from that, you will bring all these things also. That since the mother can take the help of the respite care, can get involved in the social groups, social support, and the physiotherapy, she can have the follow-ups if she has disconnected due to the small child from 6 months. Okay, she can continue with physiotherapist, occupational therapist, speech and language, whatever. You can just list all the multidisciplinary teams for the other things as well here. Okay. Just tell about the respite care and social support. Okay, I think we will take a short break now. 10 minutes.
Yes, respite care. Have you explained or should I explain?
Okay, just tell, no problem. Go ahead.
Respite care is for parents or the person who is have a baby and they want rest. Social care are coming to home or any place where the child can be kept for a few weeks. The parents can go out for have a maybe visit. They can visit outside some relaxation time because they are bothering for the child. So they should take some time for personal lives. So this is respite care because they will go away from the home and have a maybe trip or visiting some areas and
How long? How long they will
maybe
take care?
they are usually they are
Time?
telling for a few weeks, maybe 2 to 3 weeks, and
Okay, this is what.
this all the responsibilities are governed by the social service team or maybe the government bodies.
Okay. That is what we should know about this respite care. Very important in this. See, from the 2 months he is deteriorating. Maybe because of the small baby with her, and she is not able to take care of both. So they need some change and the social connection, social support, and along with that, the medical and the surgical management. We will do one thing. Now 10 minutes break for the prayer and then we will resume back. Okay.
Yes. Okay. Yeah.